Well, the health benefits I think are going to be the big thing, and I've seen lots of clients who have had type 2 diabetes and been on insulin at the time of surgery. They've stopped their insulin on surgery day and never gone back. On a lighter note, I certainly see people that further down the track, I really notice how much they smile later on, and you don't recognise that they didn't smile much earlier on. But I think a tangible and immediate benefit of any of the bariatric surgeries is that it gives you a second chance at having a really small appetite. Now you have to protect that, you have to listen to it, you have to feed it correctly, but it's a real benefit. Well, there's definitely going to be multivitamin supplements involved. There may be a full nutritional regime. And from a food perspective, I can probably use the bariatric plate to explain the three main features. And the first is about portion control. So it's going to mean having only a cupful of food as a maximum volume at a time, which is the amount that would fill the base of this plate, 2 centimetres deep in the middle. The second thing would be nutritional balance. So for this meal, for example, we'd be looking at having half of the plate filled with protein and the other half ideally with low starch vegetables. So broccoli, cauliflower, carrots, beans, zucchini, cabbage, all of those sorts of vegetables. And there may or may not be a small amount of carbohydrates, so a bit of sweet potato or pasta on there. And the third aspect is around how you eat. So the eating behaviours that will get you the best tolerance with your surgery. And all of the words around the outside of the plate represent all the things you need to think about. So things around how well you chew your food, when you drink in relation to when you eat, and the things to think about when you're eating. My role really is to help people to identify what eating is going to be like after surgery. I think that's really important at the outset. I'll be guiding them through the pre-surgical and the post-surgical regimes. I'll be looking over their nutritional biochemistry and giving advice, food-based or supplement-based. And I'll be monitoring their success. So we use the most up-to-date body composition technology to see what's happening to their muscle and their body fat as their weight changes. So bariatric surgery pretty much means that I'm in your life for 12 months or more, and there's really good evidence from around the world that the more times you see the dietitian in that first 12 months, the better your outcome. And the best news is that the original research was actually done on my clientele. So I'm confident that we're doing the right thing.